Ulcers aren't caused by stress or spicy food alone. Most are due to H. pylori bacteria or overuse of painkillers, and they're usually very treatable once the cause is fixed. A peptic ulcer is an open sore in the lining of the stomach or first part of the small intestine that forms when acid overwhelms the protective mucus barrier. Over time, acid plus specific triggers erode the lining, causing pain, bleeding, or rarely a hole, perforation that becomes an emergency, burning or gnawing pain in the upper belly, often between meals or at night, bloating, belching, nausea, or early fullness. Alarming signs: vomiting blood or coffee ground material, black tarry stools, severe sudden abdominal pain, possible perforation, dizziness or fainting, possible bleeding, anemia. Some people, especially older adults, may have few symptoms until a complication happens. H. pylori infection, a common stomach bacterium that inflames the lining and can lead to ulcers if untreated. Regular use of NSAIDs, ibuprofen, naproxen, aspirin. They reduce the stomach's protective defenses and raise ulcer risk, especially at higher doses or when combined with other meds. Less common: Zollinger-Ellison syndrome, excess acid, severe illness, or other rare factors. History and exam guide testing. A test and treat approach for H. pylori is common: breath test, stool antigen, or biopsy during endoscopy. Upper endoscopy confirms an ulcer, checks for bleeding complications, and allows biopsy to test for H. pylori and rule out other problems. Blood counts can assess anemia from bleeding. Repeat testing confirms H. pylori eradication after treatment. Protect the lining. Sucralfate or bismuth can be added in selected cases. Misoprostol may be used if NSAIDs can't be stopped. Stop or switch NSAIDs. Use only if essential at the lowest dose, ideally with gastroprotection. Consider acetaminophen when appropriate. Treat complications urgently. Bleeding may need endoscopic therapy and IV meds. Perforation is a surgical emergency. Medication plan. Take PPIs 30-60 minutes before breakfast. Finish all antibiotics exactly as prescribed. Confirm H. pylori cure 4+ weeks after therapy. Off PPIs for 2 weeks unless advised otherwise. Food and drink. Eat smaller, regular meals. Limit alcohol and caffeine. Avoid personal triggers, often very fatty, spicy, or acidic foods, but focus on overall balanced nutrition. Lifestyle. Stop smoking, impairs healing. Manage stress for comfort, not cause, and avoid late-night large meals. Pain relief strategy. Discuss safer options if pain control is needed. Avoid self-medicating with NSAIDs. PPIs heal, antibiotics eradicate H. pylori, and removing irritants prevents relapse. Don't ignore red flags. Bleeding or severe pain needs immediate care. If this made ulcers simple and solvable, tap like to boost awareness, share it with someone who lives on painkillers, and subscribe for concise, evidence-based health videos every week. Like, share, and subscribe.